The precision at Austin CyberKnife means faster recovery and better quality of life throughout treatment for their patients. Radiation oncologist Dr. Matthew McCurdy is here with specifics on how it's done. Thanks for coming today, doctor. We appreciate it.
You're welcome.
So tell me about CyberKnife, what you do there, first of all.
So CyberKnife is a machine that's for specialized types of mostly cancer treatments, but other treatments, where we want to deliver a high dose of radiation to a small part of the body over just a few days. It's non-invasive, meaning there's no cuts or incisions. It's painless. Someone getting radiation doesn't feel any different during it or immediately afterwards.
So the robotic radiosurgery system is what you're using. Tell me how that works, how you use that to help patients.
So the patient's lying on a special table, and a robotic arm actually from the automotive industry that was adapted moves around the patient and delivers radiation over 300 different angles, beams typically, and focuses the radiation right on the tumor or wherever we're targeting.
So you can stay really precise. What are some of the other benefits of this kind of treatment?
Benefits, as I mentioned, non-invasive. It's less expensive than the old way. So for example, prostate, instead of coming in for 44 different daily treatments, we can do it in 5. And so even with the more sophisticated treatment and tumor tracking, it still comes out, much more convenient and less costly.
You mentioned there are cancer patients as well as people with other situations that are treated. What are some of those different causes for treatment?
Yeah, so many different cancers to different parts of the body, and also conditions where there's no cancer. For example, trigeminal neuralgia is a nerve pain in the face. And by targeting the nerve, the pain can go away completely in severe cases. There also are things growing in the brain. They're not cancer, but they compress organs, and CyberKnife is a very effective treatment for those too.
So I guess every case would be different, but when someone is on that table, how long will they be there as you treat them? Does it vary from situation to situation?
20 minutes to sometimes an hour for large vessel structures and things.
But a relatively short amount of time. And it has to be pretty satisfying to you to be able to give people such a non-invasive way to be treated. They can continue with pretty much their daily activities, right?
It's actually wonderful.
Yeah. And it helps them to lead a better quality of life. I bet you get a great response from your patients. Yeah, awesome. Thank you so much for being here and telling us about it. Really interesting, as always. Austin CyberKnife is located on I-35 at the University Medical Center, Breckenridge. Call them at 512-324-8060 or go to austincyberknife.com.